Hello everyone, welcome to this new vlog of the Simplifying Health Economics series. This is a very special vlog because we have 5 presenters, myself, Kath, Luis, Misael and Andy, and they're all current or honorary members of the MIDAS team. Throughout this series, we talk about different key economic concepts and how health economic evaluations work. Now, we're going to focus on the interpretation of economic evaluation, and we thought it'd be a good idea to talk about our RaCEEs course, which focuses exactly on interpreting and assessing the quality of existing economic evaluations. Now, what is the RaCEEs course, you may ask? First of all, RaCEEs stands for Rapid Conversion of Economic Evaluations. We run this course twice a year, approximately from May to September and then from November to March. And it's all free and open to anyone in the ARC and the West Coast. So far, we run the course twice, and we've had 26 participants, a mix of health and social care professionals, academic staff from local authorities, and also public advisors. In this course, we have 6 online sessions where we go through the key elements of a typical economic evaluation in order to provide the participants with the tools needed to interpret and critically appraise an economic evaluation during a face-to-face workshop. So here we got the team lead for our RaCEEs course, and let's hear a bit from them. Luis, can you describe a bit more in detail how the course works?
Yes, so Valerio already explained you in general. I'm just going to give you a little bit more details in terms of the sessions that you are going to find. So the module is very simple. You have 6 sessions, and they are all aimed at teaching you something that you will need at the end in the workshop to produce a commentary. So for each session, you are going to have a 1 hour lecture that you can attend online, or you can watch later recorded on YouTube. For each session, you also have a homework where you are going to apply the learnings of that week, that specific session. So we have 6, as we already said, and you start with the first one, which is about selecting an economic evaluation. So it's about a research question. And you are going to learn how to do the searches, and you are going to learn what should be a good economic evaluation for you to choose. Then after that, you are going to start with the more technical parts of economic evaluations. So first, you are going to check the key attributes of economic evaluations, and you are going to understand what are the types of methodologies that you usually use in order to produce those economic evaluations. Then I cannot enter right now into many details, but economic evaluations are usually about some sort of cost effectiveness, which means that you need to understand the costs and you need to understand effectiveness. So the next 2 sessions, 3 and 4, are going to be precisely about the costs, how to measure them, how to find them, how to understand them. And then effectiveness, again, the same, how to measure them, how are they usually presented in the papers, etc. Then the 5th session is a session that acknowledges that economic evaluations usually work under some statistics, which means there are some uncertainty. So you are going to hear about sensitivity analysis, which is a must in any economic evaluation. And also you are going to hear about some heterogeneity, about subgroup analysis, because some intervention that works well for one group may not work the same way for another group. So that's also an important thing to consider. And finally, the last session is a mix between a Q&A and the motivation and the policy implications of the papers that you are going to be evaluating. So it's basically a part where you are going to start writing the introduction of what is going to be the final commentary. Finally, after you having these 6 sessions, so you are going to the workshop. The idea is that in session 1, some paper were selected for your group, which means that all the other sessions are all the homework that you are going to do in the other sessions are going to be directly implemented on that paper. So they are already informing what is going to be the work in the workshop, which is to try to write a commentary. In the workshop, you are going to work with your group and your team lead in order to critically appraise the paper that you have. You are going to go through a checklist of the qualities of the paper. You are going to discuss how that paper can be useful in terms of implementation for practice, and you are going to debate in terms of the limitations of the paper, what else could be done in terms of future research that could be of interest in the theme that you are working on. And that's basically it. You will see that everything, like what I said at the start, is made so that you are acquiring a little bit of knowledge, a little bit of a certain skill, in order to, at the end, produce this commentary, which hopefully we will publish in an academic journal.
Thank you, Luis. And can I ask you, what's the best thing about the workshop for you?
Yeah, for me, quite honestly, it's the variety. It's not the right word, but when I go to the workshop, I understand about economic evaluations, but the economic evaluations will typically be in fields that I have no clue about. Very technical, health-related fields, and it's very good because the paper was chosen by someone in my group that understands about those fields. It's very good to go to the workshop and basically learn, because they will teach me a lot about, let's say, that specific treatment, drug, disease, etc. And it's going to be. It has been very interesting to debate, to then, for me, learn about it and try to understand if the economic evaluation was really well done. For them, I would assume the opposite. They understand very well the disease or the condition or whatever, and then they talk with me to understand a little bit more about the economic evaluation and if it matches what they would expect it to be in that field. So I think it's this co-creation, this co-learning. It's very interesting, in my opinion.
Oh, that's great. Thank you, Luis. Now over to you, Cass. Can you tell us a bit more about the workshop? So Luis mentioned a bit the structure of the workshop, but can you tell us a bit more, what happens? It's the only face-to-face bit of the whole RaCEEs course, so we really get to know the participants a bit more. And just talk us through what happens during the workshop, please.
Okay, so the workshop is a face-to-face event which takes place over the course of a day, and it gives all the groups a chance to meet together and to discuss in a bit more detail their economic evaluation that they've chosen and the work that they've done. They usually take place either at the University of Central Lancashire campus in Preston or as part of the North West Coast ArcFests. And so the groups will get together. There'll be an introduction from Valerio, who will give us an overview of what we're going to do during the course of the day. In the morning, we have a chance to discuss any questions anyone has about any of the sessions, the online sessions, or anything from the economic evaluation that's not clear. And then, as Luis said, we will work through a critical appraisal of the paper. So we'll use a checklist tool to work through different items, looking at different aspects of how the paper's been written, how the study's been conducted, to decide on whether the paper has been methodologically well conducted or not. Then we get a nice lunch, usually, which is very nice. And then in the afternoon, we sort of consider and have a think about what the findings of the economic evaluation mean in practice. So this is where other members of the groups who come from clinical settings will bring their expertise in their clinical area and their input into what they think the findings should be interpreted in a sort of clinical practice. We will talk about what the economic evaluation says about cost effectiveness of the intervention that's being looked at. We'll also consider aspects around how easy it would be for the intervention to be implemented, particularly in an NHS setting. We'll think about barriers and facilitators to implementation, and also aspects around health inequalities and how they may be affected by the intervention. We'll make lots of notes during the day, and this will help us when we come to write up our commentary.
Thank you, Kath. That's really good overview of what happens at the workshop, which, in my opinion, is probably the best bit of the course. Same question to you, Kath. What's the best thing about the experience you had with the RaCEEs course?
So the best thing about the RaCEEs course is, I think, getting to really get a very deep look at economic evaluation, breaking it down and really understanding all the different methods that are used within a paper. It's really very helpful for getting to understand a bit more about how economic evaluations work.
Thank you, Kath. That's great. Now, Michelle, now Kath has described what happens during the workshop, which is really instrumental in then writing up the manuscript afterwards. So can you tell us a bit more about the final steps of the whole course, which is really about writing up the manuscript and co-producing with the participants?
Of course. So what is the final outcome of this course? It's a commentary that will be published in an academic journal. So first, we need to speak about the authorship. So as this is an academic journal, as this is academic work, you need to qualify as a co-author, which means basically writing a bit or a part of the commentary. If you didn't write that, you need to give feedback in the writing process and helping to revise and refine the manuscript. Everything you do in your homework will be bit by bit, actually commenting an actual paper. So once you go to the workshop, you will write more bits of the commentary. After that, what we will do is we need to choose the journal. So how we choose the journal, this will be chosen according to the paper. So for example, in a previous edition of the course, I submitted a paper to the Journal of Studies on Alcohol and Drugs. Now, why is that? Because the paper that we commented was on a drug that helped to reduce alcohol dependency. So according to the paper that you will choose and your teammates will choose, we will look for suitable papers, for suitable journals. What about the length? It's depends on the journal, actually. So the target of the wording will be set by the journal. Typically, it's about from 1,000 up to 3,000 words. So it's not a massive writing. And the publication process is like this. So we sent this piece of work, and then it would happen that it is there rejected. So, but don't discourage about that. You can choose another journal. So this typically happens in academic publishing. So this is one outcome is this rejected, and usually this happens because the editor of the journal thinks that this commentary is out of the scope of this particular journal, of this is not interesting, or something like that. So it's a normal process. Or it could happen that after reviewing, we have some feedback to improve the paper. So we will meet again online, writing, and answering these comments. And of course, the other option is that after all of this, it will be accepted. And then we can celebrate when this happens. So what we expect in terms of time. So it takes from about 6 to 9 months. So it's not short term. So it's not too long also, because it's a commentary. At the end of the process, you will get a paper published, and also you will have an insight and a bit of understanding how this kind of economic evaluations should be read or applied. We are not offering you that you will be an expert. That is out of the scope of this workshop and this training, but certainly you will be able to read, to understand, to share also with colleagues.
Thank you very much, Misael. Same question to you. What's the best thing about the course?
I think to interact with people, because everyone has a different experience, and you can, as Luis said, you can learn. So we are learning in this process. So that's fantastic to have to spend a day knowing people, what they are thinking about, what is the particular expertise. So it's interesting, and I learned because, for example, I didn't know about the existence of this drug for treating alcohol. That was really novel for me. Of course, that is in the literature maybe 10 years ago, but so it's interesting that each professional can think about an economic regulation, and they share with us, and we can learn in a community actually. So that's the main takeaway for me.
Great, thank you again, Misael. And Andy, so the last question is about the wider work from the MIDAS team. As the MIDAS team lead, I wanted to ask you, how does the RaCEEs course fit into the wider methodological support offered by our team?
Thank you, Valerio. I think the RaCEEs and the RaCEEs, which is a linked program of work, which is about summarizing evidence synthesis, more generally systematic reviews, etc., a really great illustration of what both MIDAS and the ARC should be about, and that is helping people to use research to improve the work they do, making their jobs in theory easier to deliver good quality care to the population there. And I guess it comes through some of the tenets of the kind of work that we try to do. So it's RaCEEs are really good at providing sort of training to people to help develop their capacity and capability to understand research there, because it teaches about critical appraisal, it helps us to learn to write and to work as teams together to produce an output, which in this case is a publication from it all. But it also helps with developing those networks of people to understand. I think the team sort of illustrated the fact, the importance of we learn an awful lot from people, and we hope that people learn something from we do, but it sets up those networks so that people can, both having understood the kind of research that is out there, they can understand how to critically appraise it, but also use it within their day-to-day work. But they also identify areas that need further work, and we're there as a group of methodologists, in this instance, people who have expertise in economic evaluations, information science, and systematic reviews to help people take that research further. Because part of it is coming up with, I think it was illustrated earlier, not just the things that we can implement in practice for which we can support people, but also other areas that need further research to be undertaken. And we can provide input into that to help people not only get grant income to do that, but help them to deliver those programs of work. And that's part of our wider remit. We've got a number of initiatives out there associated with wider capacity and capability development. If you go to the ARC website, into the MIDAS pages, you'll be able to see the links to courses or information there, which links to a whole range of methodologies there, supporting understanding and being able to engage with health equity and bring that into your research. For again, we have information and resources there, and the opportunity to engage with us to help you get that sort of developed within your research proposals, etc. And then wider research support, both in conducting research, but also we have some specialist methodology subgroups that people are very welcome to join, where there are discussions, seminars, etc., associated with those different methodologies to help people to undertake the research there. So our aim is all about trying to help people to create a culture of research, an environment in which research is there to support, because evidence-based practice has been around for a long time, but it still is important for us to be able to understand and work with people to make that a reality for them.
Thank you very much, Andy. That was great. Same question to you. What did you like the most about the course?
Well, for me, it's very much about the people that we work with. not just our own team, because everyone's fabulous, but about the people from the different member organizations and outside. And it helps to demystify, because you often hear people talk about the sort of academic work, etc. And the reality is that we're all come from slightly different perspectives, but we all have the same aim to our work, and that is to try and make health and social care work better and make it easier to provide that and for people to receive it as well. So demystifying all those sorts of links, and which is what the RaCEEs course does, because it makes it evident to see how economic evaluation is done, that there are lots of techniques involved, but it's not a really difficult process to understand them.
Thank you, Andy. Perfect. And thank you to all the team leads for your contribution and your views on the RaCEEs course. Now, to conclude, I just want to let you know, in the next part of the vlog, we are going to showcase the experiences and the views of our past participants, so you can get a flavor of the different perspectives, different experience that people had, and any impacts triggered by the RaCEEs course. And if you're interested in joining the RaCEEs course, we're going to leave some more information about the course below this video. And if you have any questions for us, we're going to leave some contact details as well below this video. But for now, thank you, everyone, and we'll see you next time.